we're going to position for an ankle or even a knee right now. And if you don't have to take your shoes off, just leave your shoes on. So if they have metal on their shoes, just take it off. If they don't have metal, it's fine. So this is paint and stuff. There's no metal here. But if you're skeptical, then you can remove the shoes. But you don't have to move the shoes if you know, like something like this. I have sandals on. It's not. But this is easily removable. So just letting you know that if they don't have metal and you're for sure, then it's fine. So you're going to have the patient go on the table. You're going to leave the head holder on. This is the head holder. Okay, you're going to leave the head holder on. And let's say her right ankle, scoot back a little bit, up. Her right ankle is in pain. This is a focus, right? The right ankle. You don't need the left ankle to be on it. So what you do is you bend your knees, just like that, just a little bit, small, right? Either you lift it up, she can go like this on here, if they can hold it. If not, just up like that. So, and then if they can scoot to the left, can you scoot to the left a little bit? So now they're centered. Remember, your goal is to always be into center of this hole. Isocenter, right? Remember the word isocenter? Isocenter is right in the middle. Your target area is right in the middle. So what are you going to do? You're going to bring the patient up. Our focus is the ankle. And where do you zero for your ankle? You put, yeah, where do you put the light?
At the ankle joint.
At the ankle joint. Okay. So every machine's different. You could just look at your machine when it is. Right now, let's just pretend that she doesn't have shoes on. And there's the light positioning, the laser beam, exactly. So you're going to cross here, right? This wants to be isocentered here, and then that's why I had her scoot to the left a little bit, so this line can be right in the middle of her ankle. If you need to put a towel here, put a towel here so that they don't rock their ankle. Her ankle doesn't hurt, so that's why I'm moving it. But if their ankle hurts, try not to move it as much. Put a sponge, or you guys have a sponge, right? So let's say they don't want to keep their ankle there, you just put a sponge, and that'll help them secure that so it could be isocentered. Right? And the patient's just literally gonna go in. When they're getting scanned, they're gonna go in and out. And you don't have to scan much because, why isn't this moving? There you go. And their knees is not gonna hit. You see how the knees was still away? It's far away. And you can have the patient sit up if they want, because it's just make them comfortable. They can sit up like how she's sitting up, or laying like on this. It's fine as long as they stay still, their ankles secure, and that's how you position for an ankle. Even a foot, you can do a foot like this. You can do a foot, you can do an ankle, even your knee. Your knee, because you want it center of that, right? So your knee's going to be the same thing, but you might have to either put something under the knee that hurts, and then this one you could just angle it up a little bit so you know which knee that you're focusing on, right? Because that way it's out of the way. It's no mass, it's less mass. So as you see, if she lifts the knee up a little bit, you're scanning through and x-ray goes through that. But if she had it straight down, you're scanning through two knees instead of one knee. So just, position the way you can and get things out of the way. Just like that, either like this or like this. See how you're secure, and they'll stay still. You could even put some cushion under here just to prop it up a little bit, and then that stays still. All right? Make sense?
Yeah, sure. Makes sense.
Right. And that's how you learn something today?
Yeah, something new.
Okay.